But I'm Dr. Sarah Delatorre. It's nice to have everyone here today. I'm also here with Chelsea Fechtner, who is our wonderful nutritionist. And we wanted to talk with you today about what Seattle Reproductive Medicine now has to offer from our wellness program. So I've been at our company for a couple of years, and I've worked really hard with a lot of my colleagues to develop what we call wellness program or wellness offerings, because at SRM, we think about fertility in a holistic way. We think about it as not just eggs and sperm, but all that goes into a person in terms of nutrition, sleep, stress management. Like, how are you functioning mentally and emotionally, as well as what is your body doing physically? And so we work to develop offerings for our patients that would help them become their healthiest self and optimize their fertility, or deal with medical conditions such as PCOS or endometriosis or other things that can make fertility more difficult. But even if someone's not trying to become pregnant right now, we still have great offerings to help patients with optimizing their health and promoting their wellness. So I just want to go through a slideshow kind of presenting these offerings and letting you guys know what we have. And feel free to put questions in the chat box while I'm presenting, and then we'll just go over them when I'm done. Okay, and we're going to take it kind of slow. There's a few programs that we have, and I just want to make sure that no one's kind of confused about what would be best for them, and give you guys the most information we can during this time period. So I'm going to go ahead and share my screen and start with our slides. So this is a new thing. As I said, we've been developing different aspects of the program over the last few years. And they're at a point now where we're offering them to patients, and we've had really great responses. And so the umbrella is kind of a wellness program, and the different components. The first one is nutrition and wellness coaching. So Chelsea is a certified nutritionist. She has had a lot of experience with pregnant women, with fertility, and general nutrition, and she'll be introduced in a moment. But she's also getting her wellness coach certification. And so what a nutritionist and wellness coach does is it first educates a patient about optimal nutrition, but I think more importantly, takes that particular person's nutrition habits and helps them work on helping them be better. So there's so many different diets out there, and I think it can be very confusing for patients to know what to do. And so what Chelsea works to do is to take that particular patient, and maybe you hate almonds, or maybe you will never have almond milk. Well, what will work for you, and trying to make that the best option for you. There's also some accountability there with coaching, where you guys make goals together that you're coming up with. And then Chelsea helps you to strategize how you can get there. So it's a wonderful program. We'll go into it more a little bit later, but that's sort of the overview of nutrition and wellness coaching. We also have food for fertility, and this has been around at SRM for years. And Dr. Thayer works with Judy Simon, who's a nutritionist, and they have a cooking class. And it specifically tends to be for PCOS patients, but it's also for fertility patients in general, about how can you optimize your nutrition and in a setting of cooking together. And we used to do it in person, but with COVID, we're doing them online, and patients are really enjoying it. They have a high pregnancy rate after people complete food for fertility. As we all know, that food really does affect our fertility. The PCOS consulting, this is a medical program. So a patient with PCOS, whether she's just been diagnosed or she is working on a diagnosis, and PCOS is polycystic ovarian syndrome. About 15% of the female population has it. It's a genetic influences, environmental influences, which cause us to have PCOS. But it affects ovulation, and it can also affect how we process sugar and insulin, and sometimes our weight, and sometimes acne and hirsutism, so hair growth. That's the syndrome of PCOS. There's a spectrum that women can be on with PCOS. But what we do with our PCOS consulting is a patient would work with either a physician or usually our nurse practitioner team. And that team works on the medical aspects of PCOS, such as the diagnosis, checking out cholesterol, sugar levels, and strategies to either become pregnant or optimize their health even if they're not trying to become pregnant with PCOS. And then synergistically, so Chelsea will work with the nurse practitioners between the wellness and then the medical management of PCOS. So that's our PCOS consulting. Our mental health counseling, we've had a very robust mental health counseling program at SRM for quite a few years now. We have trained therapists that work with patients who are struggling with fertility issues or struggling with mental or emotional health in regards to their fertility. We have an acupuncturist on staff that we offer for our patients to use. There's some data that acupuncture before in vitro fertilization could lead to increased rates of pregnancy. We've also launched or getting ready to launch a supplement program. This is interesting because there's a lot of supplements on the market, and so it's already a very saturated market. There's supplements everywhere. But what we found our patients saying more and more when we offered certain supplements, even such as a prenatal vitamin or a DHA, which is like fish oil, that they didn't know where to go, which brands to get. It can be very confusing. So what we opted to do at SRM was we found a brand that is a very reputable brand. And what that means is that they're third-party tested and they've been certified. So the ingredients that are in the supplements that they say are in the supplements on the bottle are actually in there. So, because if you can go to different drugstores and buy supplements and you really don't know what you're getting. So we are starting to launch a supplement line where oftentimes women who are older, we recommend they take something called CoQ10. So we have a CoQ10, we have a prenatal vitamin, and they're priced about what you would find out in the market for a high-end certified supplement. So it's just easier because you can order the supplement and it gets shipped to your house and you don't have to worry about it. So we're sort of streamlining that for patients and making it easier. And then finally, we have two awesome nurse practitioners, Ruby Boris and Ann Judge, and they have recently launched a podcast. It's called The Whole Pineapple, and pineapples come as a symbol of fertility. So it talks about the whole pineapple, like all types of fertility questions. They do a lot of myth busting. They have experts on that people can ask questions to. So it's a really great podcast that's just launched and you can check it out. So that's sort of the overview. And then Chelsea has been with us for almost about 8 months now. She is fantastic, and I'll let her kind of take over and tell you about herself and what she does.
Hey everyone, I'm Chelsea, and as Dr. De La Torre said, I'm SRM's new health and wellness coach, and I'm also a certified nutritionist. And so that's really my passion area is nutrition. And so I love to support patients in improving their nutrition and making healthy changes. However, we also address other aspects of wellness in our coaching sessions, like building a movement routine, as well as sleep and stress management. And my approach is really all about what we can add in rather than what we should be taking away. So supporting patients in adding in more fertility supportive foods to their diet and finding self-care practices that really help them feel their best and help optimize their fertility treatments as much as possible, or help manage PCOS symptoms as well. And I have experience in training in health and wellness coaching, as well as intuitive eating, and also nutrition for fertility, pregnancy, postpartum, and early childhood. So just really love help supporting couples and women all throughout their parenthood journey. And I'm really excited to be here at SRM and excited to be a part of this new wellness program. And our wellness team includes quite a lot of practitioners at SRM. We have a physician leadership team. We also have PCOS-focused nurse practitioners, and Ruby and Ann, as Dr. De La Torre mentioned, are also starting that podcast. And then also we have as mentioned, me, the nutrition and wellness coach. We have a designated nursing team focused on wellness. And we also have our mental health providers and acupuncturists. These are our designated wellness nurses. We have Annika, Jessica, and Erin, and they all are wonderful and supportive to our wellness patients and are great about checking in, providing extra resources like recipes, ideas for movement. You know, there's a lot of great at-home workouts now to kind of help stay motivated while during COVID. And so we have just tons of great resources that the nurses are always providing and checking in with and just offering that accountability that's so important for making wellness changes and lifestyle changes.
Great, Chelsea, thanks. And we'll go into it a little bit more, but Chelsea offers individual visits as well as couple visits. So oftentimes when someone is struggling with wellness or struggling with nutrition, it's kind of a partnership thing because who you live with, it really affects you. And so what I love about our program is Chelsea's able to consult with the patient and the partner. And so that allows just more of a benefit to the couple and their partnership that they can help support each other as well. With the PCOS consult, so the way this would work is if a patient was diagnosed with PCOS at any time during her life, or she suspected she might have PCOS and she wanted to see a specialist in it, she could see her OBGYN certainly, and they would be able to make that diagnosis, or she could come see us, or her OBGYN could refer her to us following the diagnosis. So our nurse practitioners, they have it's an hour-long visit. It's typically very educational. They have a slide presentation that they go through sort of explaining what PCOS is, how it affects our bodies, because it affects our bodies in multiple ways. It affects our ovaries, it affects our cholesterol levels, well, it can affect our insulin levels. So they do a lot of education. They talk about symptom management. So oftentimes women with PCOS can have acne or they can have excessive hair growth. So they talk about that, whether it's through different medications or, offering, here's a place to get laser hair removal, but they talk about how to manage those symptoms, as well as then treating any medical or any health effects from having PCOS. So again, oftentimes women with PCOS may have insulin and glucose issues, which can lead to diabetes or pre-diabetes. So there's medications and supplements that can help mitigate that and reduce the effects on our health. We often will get lab work done, blood work, again, looking at your cholesterol, triglycerides, your glucose, just checking out to see where you are in with your health when it comes to the effects of PCOS. And then finally, even though Chelsea is our main person for wellness and nutrition and coaching with PCOS, the nurse practitioner team do an amazing job with that as well. They sort of set you up with talking about goals for your health. And then it's a nice transition to having Chelsea then help you execute those goals. So that's our PCOS consult team from a medical perspective. The nurse practitioners are really sort of doing the medical management of that. If you have an OBGYN, or if we have OBGYNs who are listening, or family practice doctors who are listening to this, the doctors in our referrals can refer you in, and we will just sort of set up the patient with kind of the counseling, the education, talking about medications and supplements, and then they can remain that doctor's patient and just see us as needed, or see Chelsea for the wellness and PCOS health management part of it. Next slide is, well, my slide's not moving, so hang on. Here we go. So the one other offering that we haven't talked about is our PCOS wellness support group. So this is something that Chelsea developed. This is fabulous. And actually, Chelsea, do you want to review it since it's your baby?
Yeah, absolutely. So this is a new support group. It's free for PCOS patients, and it's a monthly drop-in virtual support group. So it's all over Zoom. So it's easy to get to. And each session includes a presentation, just a short presentation about a wellness topic pertaining to PCOS. So we've done, we did kind of managing PCOS over the holidays. Last month, we talked about meal planning. And then next month, we're having guest speaker Jamie Mamanga, who is one of our mental health professionals. And it's just all meant to provide wellness information for PCOS patients. And then we also spend a lot of time just discussing the topic, discussing what challenges come up around each topic, and also just answering questions. There's just so much information out there on PCOS. And so I just love being able to help provide evidence-based responses and answers to these different wellness topics. And they're free as well.
They're free, and they're also for even non-SRM patients, right? So people you don't have to be a patient at SRM to be able to drop into this support group. So there's a lot of information, and it's really been a great response, right? Chelsea, you have a lot of people signed up. Yeah, great. Okay, so wellness coaching, I've touched on. So there's the medical management for PCOS, which is done by our nurse practitioners and sometimes our physicians. But again, if a woman with PCOS is looking to have more of how do I deal with my insulin from a food perspective? How do I exercise more? How do I sleep better? What are strategies for managing anxiety? And women with PCOS are more likely to have anxiety and depression. So there's mental health issues there as well. So Chelsea, again, will offer one-on-one wellness coaching to help support you as you're looking to change any aspect of your lifestyle. And that can be, smoking cessation, that can be different things. It's just whatever will help you with getting to optimizing your health, whether you want to have a baby or not, right? So PCOS, you don't have to be seeking fertility to get wellness coaching when you have PCOS. So again, nutrition and lifestyle recommendations for the symptom management, talking about supplements, talking about movement patterns. And again, we've touched on goal setting. This is actually a really important part of having a relationship with a coach or a nutritionist, is that you, the patient, would come up with what do you want to do? Like dream big, like what are your goals? And then putting them down in a way that they're attainable. They're not too lofty, so you wouldn't have a lot of failure, that they're really accessible and clear. And there's something called SMART goals. But anyway, Chelsea works with you very directly on this, and a lot of patients have done very, very well with the wellness coaching specifically for PCOS. So as we mentioned, Chelsea will also meet with you for just optimizing fertility. So separate from PCOS, you don't have PCOS, you want to have a baby, whether you're struggling with fertility or not struggling with fertility. I think a lot of women, even in the preconception period, would benefit from wellness coaching and from nutritional coaching, because we know more and more that how we eat, how we move, how our stress is, all this affects our ability to become pregnant, and then also our pregnancy and our pregnancy outcomes. And so if you are looking to optimize fertility, if you haven't even started trying yet, but you think, what do I need to do to make myself the healthiest, or you have some roadblocks to being healthy, then this would be a good option for you as well. Or if someone struggled with fertility, whatever the reason would be, I think this optimizing fertility is a great option. Again, looking at movement patterns, sleep, food, whatever part of your health that you want to address that can help promote your fertility. Talking about supplements, both Chelsea and I and our nurse practitioner Ruby feel very comfortable with supplements and looking at the evidence-based data and telling you what is good for you, what's maybe not good for you, or to stop when you become pregnant. So having a supplement consultation is also a good option. There's a lot of supplements that can help egg quality, some of them evidence-based, some of them less so. So that's a good option too, if you just think, well, how do I get more healthy before I have a baby? Again, we put the goal setting and accountability in there because it's just such an integral part of coaching and a physician-patient relationship and a nutritionist-patient relationship. So what are the costs of all these? So Chelsea is getting credentialed with insurance companies. That takes time, and it's unfortunately taking more time with COVID. So eventually, probably within the next 6 months, I would guess, I don't know for sure, but I would guess that Chelsea would be credentialed with insurance companies. So they sort of approve her. That's the way this process works. And then we can bill your insurance for her services. But that's not available right now. So it's self-pay only. But we've done it in a way that is probably a little less than the general market for nutritionists, and certainly for nutritionists and coaching. So initial 60-minute visit with Chelsea would be $90. And then if you had 30-minute follow-up visits, whether it's coaching or nutrition, would be $50. And I mentioned earlier that partners can attend these sessions, and it's a little bit like a 2-for-1, because usually if you were seeing a nutritionist, you would each have to see the nutritionist, or they would bill for both of you. We've decided to offer a package where it's a little less expensive. So you get a discount if you say, I want to do a package. I want to see the initial session and then 5 more follow-up visits. You don't have to know that going in, but you have to decide that after that first hour initial consult, whether you think, oh yeah, I think I do want to come back 5 more times. There's no limit when you have to use those. So that would be the time to decide it. If you do that and you do a couple more follow-ups, then you can't get the package later on. So we try to make it a little bit more cost effective for patients because it is out of pocket. Food for fertility. So this is what I was talking about earlier with Dr. Thayer and Judy Simon. Judy Simon is this amazing nutritionist, just like Chelsea. She's been around a long time. And they've been doing this class for I think it's been 10 years. But again, Dr. Thayer likes to point out that 80% of participants have conceived, which is great news after participating in the class. It's a small class forum. There's 10 participants per class. And it's, again, individualized nutrition consultation plus the cooking classes. There's a session coming up. It's starts in mid-February and goes through the end of March. And there's just been amazing response with Food for Fertility. People learn a lot about food, learn how to cook pretty simply, where it's less overwhelming. If you're sort of not really savvy in the kitchen and you want to know what are the good foods to eat and how to prepare them without taking too much time or cost, or mainly time. But yeah, so efficient cooking class, and a lot of good feedback about this class for many years. We also have another workshop that's coming up that Chelsea is going to be involved with. We've partnered with a group called We Be Wellness. They're functional medicine coaches. And the coaches in Chelsea will work with a group of patients with PCOS. And it's a lot of education and then group coaching. So in this program, the health coaches would offer each participant 3 individual coaching sessions. So at the beginning, before the group session starts, in the middle of the 6 weeks, and then at the end. So you will be able to make individual goals with your coach, figure out where your health is and where you want to take it. And then during this series, there's a lot of education, and there's sort of framework and support for PCOS and accountability in a group setting. And the last session was very, very successful. The group of women, and the reviews were pretty amazing, and they ended up meeting outside of the seminars. They sort of formed an exercise group and had a lot of texting and supporting of each other during the process. So this is very successful. Again, there's 6 group coaching sessions, so it's 6 weeks, and then 3 individual sort of one-on-one coaching sessions. The cost is $375, and there's one coming up on February 2nd. So if you want to think about that, we can answer more questions about that too. So supplements. This was a little bit of my baby at SRM. I believe in some supplements. I think, prenatal vitamins and DHA, there's good evidence for that. But more and more supplements, as I was saying before, the supplement market is a huge market. It's very saturated, and I think it's very confusing for consumers and for patients. So what I wanted to do was to offer our patients a very, I say high end, but I don't mean it in a sort of a high maintenance way, but truly like very high quality, which is the important part, certified supplements. So you know that you're getting the best quality, and what is actually supposed to be in these supplements is in these supplements. And it's given in a way that if the doctor says, I want you to take CoQ10 for egg quality. Okay, then you go to the drugstore and you're like, okay, there's ubiquinone, there's CoQ10, how much? And so this is sort of a set thing for you that you say, okay, here's the CoQ10. I know this is the milligrams the doctor wanted me to take. And then you order it and it's delivered to your door. So you don't even have to go out. It's delivered straight to you through a third party. So you can buy it on our website, shipped to you. And it just takes sort of the guesswork out of it. There's absolutely no obligation to buy our supplements. You could look at our bottle and go buy it somewhere else. But it just allows some ease for patients to take out the confusion. So that's going to be happening probably in about another month. We'll be having that on our website. So that's one option, and then one part of it. And then the other thing is what I talked about earlier, is sort of a supplement consultation, because again, I have had many patients come in on multitude of supplements that are not necessary or redundant or even can be harmful to fertility. And so both Chelsea and I, as well as Ruby Boris, our nurse practitioner, feel very comfortable having a supplement visit where we just go through what you're on or what you think you should be on, and then kind of figure out what's best for your health, inform you about when to stop certain supplements when pregnancy does occur. So just really informative. And we can do that separately as a separate visit, or you can do that when you do your wellness one-on-one coaching with Chelsea. Again, I mentioned our podcast. This is really exciting. Ruby has been working on this for quite some time. So she's sort of she's a lifestyle medicine certified practitioner. So she's had a lot of extra training in lifestyle medicine, just as Chelsea and I have as well. And so she really centers the podcast on what we've been talking about: wellness, nutrition, physical activity, stress management, and then a lot of sort of what is real out there on the internet, what's true, what does the data show versus, oh, I heard so-and-so this and that. So it kind of breaks a lot of that stuff down for you. Lots of interviews with experts. And then she has additional content that she's going to be offering as well. So it's pretty exciting. That has launched. I think, Chelsea, do you know, I don't know if it's on Apple yet, but is it on Google?
It's on Apple now.
Okay.
And I think Marcy will probably Marcy shared a link.
Okay, good. Yeah, so it's available if you guys want to look, and there's a link in there. So that's it. That's the presentation. I'm going to stop sharing so we can see each other if we'd like to. And I'm going to pull up the chat box and see what questions there are. I'm going to go up to the top and review. We have about 15 more minutes. So any books recommending, and Chelsea, you can pop in at any point. For fertility nutrition, I'll leave that one for you. What are your thoughts on that, Chelsea?
Well, it kind of depends on, I like to make book recommendations based off of more on like an individualized level. So this is something that I often get questions on in wellness coaching sessions. So for more specific recommendations, I could do there, but kind of some general ones. I like, what is it? It starts with an egg. I like that one for supplements and nutrition. I also love one by Dr. Aviva Ram called Hormone Intelligence. I think she has just so many great recipes in there and also a lot of great information. Those are my top two, I would say.
Yeah, I agree. I like those books too. I think what I would look at for a fertility nutrition book, or just in general fertility nutrition. So there's not, and Chelsea, feel free to chime in as well. I don't think there's not one magical diet. There's not one magical food plan that will put you in the perfect spot to get to have a baby, to conceive. What we think about when we think about food and our nutrition and how our body best functions, there's a lot of data that comes back to a whole foods, plant-based diet. And so what does that mean? So it means unprocessed. So you're not buying food that's sort of prepackaged, has a lot of non-food things in it, but you're truly, I always say the basic of a really healthy diet is vegetables. And a lot of people go, oh my gosh, vegetables, but plants, you can think about it as plants. So plant-based diet. So you're thinking beans, lentils, lots of greens, tofu is a plant, soy plant. So thinking about how you can eat where you are not having a lot of processed food. I would also you don't necessarily have to be vegetarian, but there's a lot of data that limiting your meat intake helps because there's a lot of hormones in meat. I also talk about like not depriving yourself. It is so important that if you really have foods that you love, you don't have to take them completely out of your diet. Moderation really is the key. So there are fertility books out there, but I think about fertility and nutrition is thinking about eating clean, whole foods, and mainly plant-based and healthy fats. Low fat is not good for fertility. Healthy fats are. Chelsea, would you add anything else to that?
No, I think that sounds great, and I love the approach of just looking for a book that's really, I think looking for books that are about like just that of adding in more plants, more healthy fats, because I do think there are a lot of fertility books out there that push a more extreme elimination diet type things, and I think it's just really about what works for you individually and about, what can you incorporate more of, like more veggies, more healthy fats, more good quality plant-based proteins and things like that. So, I definitely agree with everything there. And I
Yeah.
think that second question underneath this one was in relation to the supplements. What brand is it? Just that was,
Oh, so
yeah.
we are the supplements that we are using is a supplement brand called Zymogen, Xymogen. So that's the one I chose to use so it's their supplements with our label on it, and I chose specific ones for PCOS, for older women who are trying to conceive, for sperm health, and then for general health and wellness. So we'll be launching that pretty soon. So someone asked about how do you join the PCOS support group, and Marcy has put the registration page up there. How often are the wellness coaching sessions? That is up to you and Chelsea. You guys work together with your schedule. There's no end. Like if you had one and then you couldn't meet for 2 more months, that's fine. It's based on your schedule and what works best for you and Chelsea. The insurance, no, we talked about that. Unfortunately, not yet. Insurance will eventually cover, but I'm just kind of working on getting credentialed. Is the relationship of PCOS and anxiety, is it that direct physiological, like a variation of stress hormones, or more of correlation affecting fertility? So both. So we do know that there is, so all of us process adrenaline, our stress hormones and cortisol different. And we have things called SNPs that allow us to keep those hormones around longer or metabolize them very quickly. All of that is genetic related, and part of that plays into PCOS and anxiety and depression. So there is a direct correlation. And then there's also just life, right? So PCOS patients will potentially struggle with acne, hair growth, weight gain. That absolutely, those environmental factors can lead to depression, anxiety, and then on top of it, fertility. So I think it's definitely many reasons why people with PCOS have anxiety and depression. And again, some of it is direct. I think that's an excellent question. And then some of it's indirect. And that's true with fertility too. A patient can come in and, fertility she was already had anxiety, and then struggling with fertility has made her more anxious versus she was never anxious until she started her fertility journey. So, Marcy's put our wellness page and the link, lots of links, which is great. I'll have to double check on our CoQ10 and soy. I don't know off the top of my head, but I will look. And oh, good. Someone loved the podcast already. That's awesome. I'm just kind of going through stuff. Yeah, looks like that answers the questions.